Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We're going to be speaking with Dr. Suneet Grewal. She's joining us here from East Bay Rheumatology Medical Group in the Bay Area to talk about the Supplemental Biologics License Application, or sBLA, to expand the label KRYSTEXXA plus Methotrexate to treat uncontrolled gout. Welcome to Health Professional Radio, Dr. Grewal.
Thank you for having me.
As I said, you're going to talk about this sBLA, expanding the label of KRYSTEXXA. Give us a bit of your professional background and talk about your role at the East Bay Rheumatology Medical Group.
Yes, I'm happy to do so. Yes, I'm a community rheumatologist practicing at East Bay Rheumatology Medical Group in the Bay Area. I received my medical degree from St. George's University, completed my internal medicine residency at Alameda County Medical Center, and my rheumatology fellowship at Cedars-Sinai Medical Center. I have a particular interest and passion for treating gout, and so we have quite a diverse population where I practice. I see a lot of gout patients, and I've also served as the principal investigator for several clinical trials on gout, on KRYSTEXXA, including the MIRROR and FORWARD randomized controlled trials.
Now, you mentioned having a diverse population where you're practicing. What is gout briefly, and who's most susceptible?
Yeah, so gout is one of the most common inflammatory arthritides in the U.S., and it actually does affect a very diverse population. There's a misunderstanding or misconception that gout only affects older men, and that is not true. Actually, after menopause, women are at equal risk for men, and all ethnicities are at risk for this condition. And so basically, as an inflammatory arthritis, gout can affect the joints, cause immobility for patients, can cause decreased quality in life. And furthermore, it can cause cardiovascular, or is associated with cardiovascular comorbidity. So it's an important condition to identify and treat in an urgent manner.
So what has been the historical treatment for gout?
So prior to KRYSTEXXA, we had very few effective options to treat gout. And even when we are able to optimize those treatments, which are very few in number, unfortunately, they don't work quickly to significantly reduce the burden of arthropathy that patients are dealing with. And so with the advent of KRYSTEXXA, the first and only biologic to treat gout, we finally had a faster and more effective option. Unfortunately, though, safety and overall efficacy of the treated group was limited for these patients.
This sBLA to expand the label, give us a bit of insight into this application.
Yes, when KRYSTEXXA came onto the market, we felt rather limited in the effectiveness and the safety of the drug as a monotherapy. But over the last few years, it's been rather exciting to see that we can actually enhance the safety and efficacy by combining KRYSTEXXA with an immunomodulator such as Methotrexate. So last month, the FDA granted priority review of this sBLA to expand the label for KRYSTEXXA plus Methotrexate, which is an immunomodulator that we commonly prescribe in many rheumatologic conditions, but over the last several years have found that it is enhancing the efficacy and safety of KRYSTEXXA or pegloticase. So the sBLA is based on the MIRROR randomized control trial, which showed improved treatment response rates through the use of KRYSTEXXA plus Methotrexate compared to KRYSTEXXA with placebo. And in that trial, 71% of patients who were randomized to receive KRYSTEXXA in combination with Methotrexate achieved a complete serum uric acid response, which means that their uric acid was able to be at goal for at least 80% of the time during month 6. So that was the primary outcome. And so this trial added major insight to the evolving body of data that we've had over the last few years, which were prior to this trial, an open label trial, some published case series that had shown us that co-treatment with immunomodulatory medications can mitigate antibody production and improve the response rate of KRYSTEXXA. So since KRYSTEXXA is the first biologic treatment for gout, this sBLA is important to help ensure that patients have the best chance at responding to therapy.
Now, even though patients have been responding or those who aren't going to respond are having problems, there is a huge unmet need for simply this fast-acting, long-lasting treatment, correct?
Yeah, there is. So, we are somewhat lagging behind on truly treating gout patients in the most effective way. And, unfortunately, gout patients have a high risk of cardiovascular morbidity, mortality, and unlike some of the other conditions where, such as rheumatoid arthritis or hypertension or diabetes, where, we understand that treating to target and treating in an urgent manner reduce those long-term complications. We're not quite there with gout. There's a huge unmet need to better and more effectively treat these patients. And with KRYSTEXXA, we finally had a good chance at that, but we needed to better optimize the treatment so that patients really could get the most out of this treatment.
Is there a problem getting the word out to healthcare providers about these developments or coming developments with KRYSTEXXA as it relates to their gout patients?
Yeah, absolutely. I mean, gout is one of those conditions that truly is a collaborative endeavor, a collaborative treatment endeavor for these patients. These patients are seeing primary care. They're frequently in the emergency room. They're often seeing podiatrists, nephrologists, orthopedics, in addition to their primary care physicians and rheumatologists. And so it is really crucial that, all physicians who are taking care of patients with gout understand that there is this treatment there and that we have optimized it, and we're hoping that the FDA will grant, the authorization and expand the label so that there is this better understanding of the combination therapy.
Well, is there a website or some other resource that you can give our listeners where we can learn more?
Yes, absolutely. I mean, there are many websites that patients and practitioners can refer to. My own website is eastbayrheum.com, but the American College of Rheumatology is a great general resource where the latest gout treatment guidelines are updated and available as well, and that's rheumatology.org. So I encourage patients and practitioners alike to become better educated on gout and pay attention to the latest developments in the treatment of gout with KRYSTEXXA and immunomodulators.
Dr. Grewal, thank you so much for lending us some of your time this morning. It's been a pleasure speaking with you.
Thank you. Likewise. Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Suneet Grewal. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.